Hello, thank you for joining me in the health and safety in the health and social care workplace module. Now, module 4.25, which is focusing on health and safety, is one of the important modules in health and social care. Every worker in the sector is supposed to be able to understand key health and safety issues in order to make sure that you work in a safe environment. So we'll first look at the aims of the model. The main aim of this unit is to help all learners understand the concept of health and safety and how it can be applied in the health and social care setting, irrespective of where you are working. We've got three main learning outcomes to cover. The first one is to be able to understand how health and safety legislation is implemented in the health and social care workplace. This could be in the care home, in the GP surgery, in a hospital or other environment that residents or patients are kept. Now, without following health and safety rules, we wouldn't be able to operate effectively as health and social care personnel. It could be a GP, a surgeon, a nurse. It could be a carer. We are all required to understand the concept of health and safety in the workplace. So the first learning outcome is to help us to understand health and safety legislation. Number two, we need to understand ways in which the health and safety requirements impact on customers and the work of practitioners in the health and social care workplace. In terms of customers, we are dealing with a patient or resident in the health and social care place. In terms of practitioners, we are talking in terms of all health and social care workers. And as I said earlier, it could be carers, nurses, and doctors. They are all practitioners, right? And the last learning outcome, we'll try and understand the monitoring and review of health and safety in the health and social care workplace. The reason being that issues of health and safety keep on changing at all the time, depending on circumstances that we find ourselves in. We might bring in new patients or new residents who need different requirements in terms of health and safety. For instance, if a wheelchair user is admitted into a care home, there's a need to assess the needs of the patient and the environment in which the person is coming. So there is constant need to monitor and review all health and safety issues. Now, we need to understand what health and safety is all about. Health and safety is an essential consideration for all practitioners in health and social care. And this unit will enable learners to develop an understanding of the importance of continually monitoring the implementation of health and safety legislation policies within any health and social care setting. At the end of this module, learners will gain a clear understanding of the implication of relevant legislation for their own role in the implementation of policies and systems in their workplace. Here, the importance of record keeping, monitoring, review health and safety policies and procedures will also be considered. Elements of this unit should be contextualized where possible to an appropriate setting relevant to learners' workplace in the health and social care sector. So in terms of answering the questions you should be able to contextualize it into your own workplace. Now, if you are currently working in the care home, of course, you need to answer the question in line with your experience with health and safety issues in the care home. In the same way, if you are a nurse working in a hospital or GP surgery, try and use an example in your own environment to be able to answer the questions appropriately. The next slide looks at the assignment structure. I've tried to guide you as to how best you'll be able to answer the questions. First, is your introduction. Give us a background, a brief background of what you actually intend to achieve in the assignment. Begin with definition of concept of health and safety and describe what you intend to achieve in this assignment. Please make sure that you reference the relevant sources in the test and provide bibliography at the end of the paper. Because this is an academic exercise and you need to state all the sources that you have used. Right. Now, apart from the background information, you need to present the main body of the essay that seeks to answer all the assessment criteria. So the first part, you could describe the health and social care setting you are using for this assignment. For instance, if you are working in the care home, use an example of the care home situation. And then the body of the essay should cover all the assessment criteria for tax 1, 2, and 3 in the assignment brief, which is found on the model. Having done that, try as much as you can to draw the conclusion for all that you've done in the body of the essay. Summarize your findings, and then, if possible, give recommendation as may be appropriate. It's a simple assignment structure that if you follow, it will make your work quite good. Right. Now, let's try and then look at key concepts in health and safety. If one should ask you, what is hazard? What is risk? How do you explain that? Now, the hazard, as defined by TUC, is something that can cause harm. So anything that can cause harm or is likely to cause harm is a hazard. And risk is simply the chances of that hazard happening. And it could be a high risk, low risk, or medium risk, depending on how you see it. That any hazard will actually cause somebody a harm. And there are wonderful examples that has been given here. If you look at the condition in the care home, we might have a wet floor as an example of hazard. Wet floors are actually likely to lead to what? Risk. And that could be slips and fall. It's a typical example of the harm that can be caused by the hazard being the wet floor. If you consider behavior as a hazard, a typical example could be bullying. And even though bullying might not result in physical harm, you might tend to have psychological harm in terms of anxiety, fear, and depression. A source of energy is another kind of a hazard in the workplace. And a typical example is electricity. And the harm that may cause might be through electrocution. Right. So these are all sort of example of workplace hazard, an example, and the harm that can cause. And I believe this is going to help you to fully understand the concept of hazard and risk. The next slide. How do we minimize risk? How do we minimize risk? Now, this can be done by trying to identify the hazard by carrying out a workplace risk assessment. Of course, if you're able to identify hazard, then you are minimizing the risk. So we try to identify hazard by carrying out workplace risk assessment, determine how employees might be at risk. You evaluate the risk, record and review hazard at least annually or earlier if something changes. And as I spoke on earlier, if you have a new resident who is hard to hear or who has got visual impairment, of course, once you bring that person into the home, you need to assess risk immediately because the situation has actually changed. So you might be doing risk assessment as often as possible, depending on the situation. Now, who is responsible? Responsibility and liability. Responsibility falls on both the employer and the employee. The employer should be able to draw health and safety policy and all procedures and ensure that it is implemented. The employee has also got the responsibility to make sure that health and safety policies and procedures are followed. Now, if this is done, then we are bound to prevent accident and then protect people, the staff, our colleagues, residents, and ourselves from harm. The next slide will look at current health and safety legislations. Well, there are a range of health and safety legislation that covers health and safety, which is more linked to the health and social care environment. Of course, health and safety applies to all. If it's in the field of construction, health and safety applies. If it's in our home, health and safety applies. But then in terms of the health and social care environment, the key legislations are Health and Safety at Work Act, which is quite crucial. We also have Food Safety Act. As long as we provide food to residents in the hospitals and in the care home, this Food and Safety Act and the Food and Safety Regulation is quite relevant in our health and social care setting. We also have manual handling operations and regulations. This is also quite important. So one of the areas that need to be looked at in detail, manual handling operation regulation, how to lift residents, how to lift loads. For instance, if you are working in a care home with a resident who is quite big, you have to decide whether you're going to use hoist to lift the person. You need to assess the risk involved, whether you're going to lift the person yourself or you call a colleague to come and help you. So manual handling regulations are quite key. And then we have reporting of injuries, disease, and dangerous occurrence regulations. There are laid down rules that need to be followed. So this legislation is also quite important. And then we have control of substances hazardous to health. There are so many substances that we use for cleaning and others that are hazardous if not handled properly. So all these legislations are quite crucial, and we need to understand that and see how it impacts the issue of health and safety in the health and social care setting. In fact, during the Industrial Revolution, such legislation did not exist. So there are many harm caused to people. For instance, in the textile manufacturing industries, young children were asked to be removing torn out cotton from the machines. Because of their small body, they are able to go inside and remove it, and this led to a lot of amputation of hand, as well as inhaling of a lot of dust particles that cause lung problems. So this legislation were laid down to be able to guide employers to how best staff, resident health will be protected. And this is quite crucial in the health and social care sector. The next slide, look at other legislations apart from the key ones that I've just mentioned. We have the Health and Social Care Act 2008, the Care Standard Act 2000, we have the Mental Health Act 2007, Disability and Equality Act 2010, Children Act 2004, and Child Care Act 2006. We will look at this all in details. These are all key legislations and then other legislation that you can use to answer your questions. The next slide will look at system, policies, and procedures. Every setup should have health and safety management system and standard that needs to be met. And then every environment should be able to carve out their own health and safety management system and standard to suit their environment. And make sure that whatever policies are made are applied. So the implementation of health and safety procedures is quite crucial. And because of that, there need to be people who will be assigned responsibilities, and training must be given so that all health and social care staff will be able to know their responsibility in terms of maintaining health and safety in their working environment. And then we have compliance with legislation and guidelines. If we are not able to understand and apply and implement the procedures properly, then there are dire consequences in terms of financial cost and serious situations. If it's a care home, it can face closure. So the issue of compliance with legislation and guidelines are quite crucial. And that means that there should be good record keeping, where all near misses are all recorded. And then we have frequent audit, reviewing and monitoring the systems alongside. The next slide, we come back to responsibilities. Who is responsible for making sure that the working environment is safe? Employers have key responsibility. They have to make sure that the right procedures and policies are in place and ensure that staff comply with that. That does not mean that employees have no responsibility. Employees are also supposed to ensure their own health and safety, ensure the health and safety of other staff, and most importantly, ensure the health and safety of the clients, which in this case might be patients or residents they are caring for. This means that there should be an appointed officer who will be responsible for health and safety at every health and social care health place. There should be a responsible person who will ensure that policies and procedures are being implemented. Now, responsibilities. When we say responsibilities, it's just simply following procedures, working safely, having training of staff, and provision of health and safety equipment, ensuring compliance with the new legislative requirement in order to ensure safety of the workplace for themselves, for residents or staff, and even for visitors. Right. So every employer is required to provide a policy and procedures. And apart from that, provide equipment for staff to use. For instance, the typical care home environment, there should be gloves for staff to use. There should be sanitary equipment. Beside that, there should be hoist to be able to lift people up. Anything that is possibly going to cause harm, the employer is supposed to provide every equipment to make sure that such occurrences do not occur. If you look at the construction environment, the employer is supposed to provide hard hats, goggles, safety boots, and gloves. In the same way, in the health and social care setting, all tools and equipment that will ensure health and safety of staff working there, as well as residents or patients, should be provided, so as to make sure that there will be smooth implementation of the health and safety policies and procedures in the workplace. The next slide still look at who has the responsibilities. So again, we are saying that the employers have core responsibilities, employees, appointed officers, individuals, carers, anybody at all having access to service users and provision. So in the health and social care environment, everybody is responsible for maintaining health and safety in the workplace. However, priority in specific workplaces need to consider the safety of the staff, safety of the service users, and safety of visitors. So all staff working in the health and social care environment should ensure their own safety, safety of their colleagues, safety of service users, and then safety of any visitor that comes to their working environment. Now, that is a brief introduction to health and safety policies and procedures. If you go in the module, we have provided an assignment which you can access it. And as I said, use your own workplace environment to contextualize your assignment. Reference it nicely using Harvard referencing system. Make sure that all references that you cite in the test will appear in your reference list and support all claims that you are making in writing with sources so that the work will be quite academic. If you have got any questions to ask, please contact me via email and we'll discuss it further. Thank you for attending today's session. Thank you. Bye.